With this, I'd like to turn it over to Rich Miller. He's the CEO of Virtua. Rich has led the system in innovative directions by creating a value-based culture defined by the STAR initiative, adopting Six Sigma and other process improvement tools, partnering with industry leaders such as GE, and transforming a group of community-based hospitals into technologically advanced regional medical centers. As an industry leader, Miller's efforts were recognized nationally with appointments to the Leadership Advisory Council of the Joint Commission Center for Transforming Healthcare and to Governing Council of Healthcare Executives for the American Hospital Association.
Thank you.
Thank
you.
you.
Okay. If you don't mind if you're filming, I know you guys are, can I stand over here? You're right with that?
By all means.
Sure, because I can't stand behind a podium. Welcome, everyone. It's great to have everybody here today. I want to welcome my team in the back of the room, even Lisa Ferraro is sitting in the back row. Lisa, how are you back there? You behaving yourself. Good to hear. But my teams, these are some of my great nursing directors, my management engineers, my black belts, they're all in the back of the room. They're the best, and they're the people that make Virtua tick every day and make it work well every day. So thanks for being here, everybody. Thank you for being here today. Hopefully what you're going to see and hear over the next day is a little bit about this journey in building this new hospital and why we did what we did. To give you a little bit of history personally and why this hospital is so important to me personally, it was 37 years ago when I was in a terrible auto accident, and that was 1974 in my senior year in college. So you can see how old I am by telling you that. But it was a senior year in college. I was riding a little Volkswagen Bug, and I hit a bridge abutment going 40 miles an hour, fell asleep at the wheel. So my journey in healthcare started at that point in time when I was actually flown to the University of Maryland Shock Trauma Unit in Baltimore. Some of you may be familiar with that. So, you know, taking that, I remember the helicopter ride vividly being flown in. Well, I ended up on a vent. I ended up with total renal failure, total lung collapse, and it was pretty messy. And I spent a number of weeks in that shock trauma unit. And the experience taught me a lot about some of the things I wanted to see in healthcare and some of the things I didn't want to see in healthcare. Shock trauma units back in 1974 were dark, dens. If anybody worked in one or been around one, you had no contact with the outside world. In fact, family members were not permitted to come into the shock trauma unit back in 1974. The only contact I had with the outside world when I was laying in my bed was a beveled glass window that I could see if a thunderstorm was outside, because it was May time, it was April-May time, so we did have thunderstorms. But what would happen to me as a patient back in 1974 is depression would set in eventually. The reason I left the hospital was not because of my physical condition, because I still wasn't well enough, but I was depressed. I was 21 years old. You know, laying in a hospital bed for weeks caused depression, and it was better off that I got out of those surroundings for my mental status, not so much my physical well-being. But what I saw laying in that bed was a different approach to healthcare. I saw great nursing. I saw phenomenal nurses who slept in the shock trauma unit to take care of their patients. They were incredible, and that's a part of it I'll never forget. The other part that's sometimes forgettable is the way the residents and fellows handled me as a patient. And I was fully cognizant. I had tubes coming out of everywhere, so I couldn't speak, but I could hear, and they never spoke to me about they spoke about me, but they never spoke to me about my condition. So when we talk about patient communication today, with how important that is, it is important. You know, I was a 21-year-old kid. I wanted to know more. I wanted to find out where I was going, what the prognosis was. It was important to me, you know, what the long-term prognosis was for me. So that communication part was very important. I also got addicted to Percocet, which was probably the toughest thing to come off of it as part of that journey. But, you know, watching the care of nurses and doctors and getting me better from being addicted to that drug was a real positive experience. So the darkness, the lack of information, the environment of care became very important to me as I grew in a healthcare career. And after that experience, and after I've been in healthcare now for for about 35 years, and after I got well and got into healthcare, I vowed that I would make a difference in caring for patients with great clinicians. And I'm fortunate to be here at Virtua because it always starts with people. It always starts with great people. And my people hear me talk about that all the time, but there's no truer words are spoken. If you have a great team of clinicians, you can do a lot of good things. The building's a nice accoutrement, it really is, and it's important, but the staff drives patient care and drives patient safety every day. So that's important. So a little personal history and why this hospital is very important to me. And as I said to somebody a little bit earlier, the outcome was better than the plan. And I really feel good about that because when I walk around this hospital all the time, I see what we've created for patients in our community. And that's the key, is how you created a great health hospital for patients that live in the community and see it every day. So the plan of this hospital started with a board approval back in 2002. It's 9 years in the making, this hospital. And I brought it to the board initially with the thought of this being a replacement hospital for 3 hospitals, not 1. So we were thinking, you know, maybe we need to replace 3 hospitals, build it here. But it quickly, I got smart real fast because realizing we couldn't afford an $800 million project, we had to scale it back. And we scaled it back to replace the existing Voorhees facility at $463 million. And that's something we could do, we thought we could do. So we started the journey in 2003 and started the planning of this facility in 2003 moving forward. And we wanted to design it, the key was to design it around the patient and the clinician. I mean, that was the whole goal of this. And believe me, I toured, and all of us toured hospitals across the country to see, the latest ones, to see the design of those hospitals and how they were built. Frankly, I saw a lot of money spent in areas that I didn't want to spend money. You know, a lot of elaborate lobbies, a lot of things where there was a lot of marble and a lot of mosaics, and I saw it all and I said, that's not where I want to go. I want to spend the money around the patient care areas, and that's the design I wanted to have. So we started on that journey with our architects. We chose our architects, we chose our construction company, and we put our team together. The good news for us here, and you're going to hear a lot about this, is we have our own management engineers and we have our own black belts. So using design for Six Sigma and using lean principles in the construction of the hospital was very important. And we did that starting from the ground up. So we used our own people and used the community, the patients, our clinicians, to build up the mock rooms that this hospital was designed off of. So we really painfully went through a number of years of design and redesign because we wanted to get this hospital right. Then our journey started with putting the steel in the ground about 3 years ago. And we put our steel in the ground probably in the worst economic time this country's faced, which was people really thought I lost my mind. They were a little bit unsure if I lost my mind at the beginning, but now they were sure because now we had to finance this project, which became an issue. So we had about $100 million into the project in 2008 as we were starting construction. The stock market and the bond market hit rock bottom. So I said to my CFO, you know, how much time do I have to get to the markets? And Bob said to me, this was already the beginning of 2009, he says, we have about till the end of the year. Now I was already thinking, am I ready to pull the plug on this project? I had steel up because one thing I wasn't going to do was compromise patient care at Virtua. You know, I wasn't going to spend money that we didn't have that would compromise our staff and our patients. So I had to make that decision in the beginning of 2009. So we decided that let's keep moving, let's see if the market frees up. So I get this, I was in Washington, I was the AHA conference in Washington, and I got a call from my CFO, we got a window to sell the bonds, and it's the next couple of days, so we're going to New York to sell the bonds. Well, we went to New York, we had, you know, $500 million in bond sale, and we oversold the issue. And the reason we oversold the issue was Virtua was a good credit. People wanted their money somewhere safe, and it just, people were buying it. The retail market and the institutional market were, in fact, the retail market bought first. They were buying like crazy. Now the institutional market wanted to jump in because they weren't getting any of the sale, and then they jumped in. So we did very, very, very well on the cost of capital to build the project, which was important for us. We needed to have a good cost of capital. The other thing we did well with this project, at the time we started to build, was we had the pick of the litter in the labor market because, frankly, nobody was working in southern New Jersey. There were 2 casinos in Atlantic City that were supposed to be built that didn't go under construction, and they were pulled back. So we were the only construction game in town at that time, and we had the best benches and labor that we could find. And with things being so difficult, we were able to negotiate good labor costs as part of the project, and you'll hear more about that as well. So the project took flight, and we started to move ahead. The one thing you learn in building something this big is you got to stay to budget in the project. And that's one thing I told our team, we're staying to budget on this project. It's very important that we do that because we're not going to have the funds to go beyond it. And this project came on budget, on time, and that was the beauty of it. Our team, Mike Kotzen and Barry Grafley, you'll hear from later, as a team, worked with the municipalities, the state governments to pull all the things they needed to pull together to make this work. So, here we are, and then we moved along, and then May 22nd was coming, which was our move day. And I'm sure Tejas will tell you a little bit, and Joshua will tell you a little bit about move day, which was a phenomenal experience in terms of what we did on the move day. And we used not one consulting firm to plan the move day. We used our own management engineers. They built the model of move day for us themselves, and we used it. We moved, how many patients, Mike? 145 patients in under 4 hours. And that's how efficient the model was in the move. And I watched it firsthand from the old Voorhees Hospital to the new one. So I have to tell you, with a great team and great management engineers and great people, we were able to do something phenomenal on move day that's probably won't be duplicated for a long time on a move and how well it was done. So we're very proud of that. We're very proud of this hospital. When you tour this, I think what you really want to look at and what will be described to you is the patient floors and how the patient floors were designed and how they were designed around the patient. And care was taken, and the technology on the floors as well, and how that was built around the patient. You really want to take a look at that. And it was painstaking. I mean, even our NICU, where we weren't going to a private room NICU initially. Our nurses didn't want to go to a private room NICU. There were a lot of reasons they didn't want to do that. And we went out to the University of Pittsburgh Medical Center and saw a private room NICU. As soon as our nurses and physicians saw how the private room NICU functioned and how it was better for safety and care of a neonate, we went to a private room NICU. So there were some things we changed along the way in terms of our thought process in design and what we did in this building. But again, it's patient-centered. You're going to find that. It's clinician-centered for our nurses. And one thing we wanted to do was, and I told Tejas, if I see one more spaghetti diagram, I'm going to choke somebody. But we saw a lot of spaghetti diagrams, and some of that was around clinical flow and how much time our clinicians were spending walking. And the numbers were staggering. I mean, we were finding out our nurses were walking from here to Florida on an annual basis. I mean, that's how much time on their feet they were spending, wasting time without attending to patients. So the goal was to put things around the nurse and the caregiver so that everything was right there. So if you're caring for 6 patients on a med-surg floor, you have the availability of things, equipment, and technology around you. And I think the other thing you'll find here is the equipment we have an RFID system here where equipment is tagged, and nurses aren't looking for technology anymore. They're not chasing a pulse oximeter at the end of the hallway. I mean, it's in front of them, and it's right there for them. And if a piece of technology needs to come upstairs, it's upstairs in minutes. So, yeah, that's what we have here. The other thing you'll find in this facility, I talked about darkness in a shock trauma unit. There's no darkness in this hospital. There's abundant light everywhere. Everywhere. You're going to find it everywhere. We even have a window outside the OR. I mean, light is a good thing. And you'll see as you walk through this place, you're going to be amazed at how much light. We don't have a lot of sun today, but you'll see how much light you have, not only for the patients, but for the families. That's important. You remember I told you about communication earlier as well. Families are involved in their care, their loved ones' care here. We've incorporated families in this. So every family member, every patient can designate 3 people that help them through the care process. And we tag those people, you know, we put a bracelet, we tag them, and they have 24/7 access to the hospital. One person usually stays overnight. And what we're finding, and Mike was telling me this earlier this week, we're finding patients are going home earlier because the care of the patient is better with the family member in the room. And we're communicating with family and with patient at the same time. So we're finding that to be a great help. And you'll see that how it's built into the zones of the room when you visit the room. A very important aspect of patient care is family. And that's built. And that's something I missed in my shock trauma experience. My family couldn't visit. So frankly, in that experience, I could tell you, I didn't know if I was dead or alive in that shock trauma unit. So the key was having somebody you know and are aware that can help you through your tough experience, and that was important too. So you'll find that as part of your experience here as you walk through the facility. So I'd love to have your feedback. I'd love to hear what you have to say about this facility, what you see in this facility. You won't see, you know, ornate lobbies here. What you'll see are lobbies off the patient care areas because families need to have quiet time and they're right off the units. So they can come off the end of the unit and sit in an area and have a discussion with their family member. And we also have physician consultation rooms in those areas as well for physicians to talk to family members as well. So it's kind of how do we decompress the family as well as the patient in this process of care. All right, you'll see a lot of that. So enjoy your day here. I hope you really enjoy yourselves. We have a great team that will walk you through the care process. They built the place. I didn't build this place. The team built this place. Mike and Barry and the entire team. So enjoy what they have to tell you. Ask any question that's on your mind about the facility. We're here to help you go through this, and we'll tell you what our thought process was, whether it's right or wrong. We'll tell you what we think. Okay.
Thanks,
Okay?
Mike.
Thank you. Thank you, everybody. Enjoy.
We have for today.